Hi everyone, I want to talk about Dvt treatment, deep vein thrombosis treatment. Okay, let's go. The first thing to consider while thinking about Dvt treatment is what are the possible contraindications to anticoagulation in this patient, and that will include any active bleeding, is there low platelets less than 50,000 per milliliter, any intracranial hemorrhage, any recent brain surgery, is this individual pregnant, any malignant hypertension, recent stroke, recent major surgery, liver failure or liver impairment, and severe renal failure. If there are no contraindications and the individual is symptomatic, then go and make selection of the anticoagulant you're about to use. You can go for Heparin or Warfarin or low molecular weight heparin for the first 3 months. Factor 10A direct thrombin inhibitors like Xarelto or Eliquis could be used. Fondaparinux, Betrixaban, and Edoxaban could also be used. If the Dvt is provoked, for example, if there is surgery or oral contraceptive or prolonged sitting, then correct the risk factor first and stop after 3 months of therapy. But within those 3 months, you have to carry out some laboratory tests to be sure that you are winning. There will be a lot of ifs here because it's not going to go in one direction. Okay, another if is if it is unprovoked or persistent risk factor or unresolved provoking factors, then the anticoagulation usage should be for a longer period of time, for almost 1 year or indefinite. If there is distal deep vein thrombosis and it is asymptomatic, but it is extending proximally, then you have to treat like above. If it is asymptomatic and not extending proximally, then you check for contraindications to anticoagulation. And if you are comfortable, then give your anticoagulant. If it's extending proximally, give anticoagulants also. But first of all, rule out contraindications. But there are some situations when you observe only. And that will include when there are contraindications to anticoagulation or patient refuses anticoagulants, then you're not going to leave the individual to die. You start surveillance with Doppler and D-dimer assay. If the Dvt is proximal and you've checked out for contraindications to anticoagulation and there's none, then you are free to use anticoagulants. And here you can use Heparin, Warfarin, low molecular weight heparin, factor 10A inhibitors. But if there is phlegmasia cerulei dolens, which means a life-threatening complication of acute Dvt with pain and cyanosis or gangrene, then you are going to change the course. And this time you have to use thrombolytics like recombinant tissue plasminogen activator, TNK, or even surgery, thrombectomy. If it is proximal and there are contraindications to anticoagulation, then you are left with no option but surgical intervention. You can use in vitro vena cava filter, Check for contraindications after inferior vena cava filter. If you have retrieved the inferior vena cava filter and give anticoagulant as comfortable tool after checking out for the possible contraindications. If it is heparin-induced thrombocytopenia, stop heparin, then use Fondaparinux or agatroban or danaparoid. If the woman is pregnant, please no Warfarin, but you are free to use low molecular weight heparin or unfractionated heparin. You can see that we are not going to leave the patient alone to die. No matter the situation, there is always a way out. Okay. You can discharge home or you will not admit if the patient is stable hemodynamically, if there's decreased risk of bleeding, if there's no renal insufficiency, or compliance is guaranteed. Let me repeat. You can discharge home or you will not even admit in the first place if the individual affected is stable hemodynamically and if there is decreased risk of bleeding or there is full and good renal functioning, and you can guarantee that the compliance with medication will be there. If there's malignancy as a risk factor, then it will be advisable that you go for low molecular weight heparin. Remember, also in pregnancy, no warfarin, but you can use low molecular weight heparin. There must be a good monitoring program in place though, and start working on preventive measures immediately. And with that, I've come to the end of presentation as far as Dvt treatment is concerned. Kindly subscribe to my channel and you can get my presentations immediately they are published. You might be wondering, how about investigations? Check all my videos. There's a separate video on how to make the diagnosis. D-dimer, Doppler, and angiography, and so on and so forth. Thank you.